morning. So right now I'm gonna perform an inline suctioning. So with that first, and we should always take note, check the patient's chart for any important details. Right after that, make sure we wash or sanitize your hands, wear appropriate PPE such as gloves, masks, and if possible goggles. Once we're about to go inside, greet the patient, explain and introduce what we're trying to do. Let also the relatives, if present, know what we're trying to do and let them understand. And also make sure we check the patient's ID band for confirmatory purposes. Right after that, make sure we also have to listen to the breath sounds. Take note also by doing our assessment such as the SpO2 level, patient's color, their level of consciousness, and also their heart rate. And then make sure we position the patient's head elevated. And then moving on, we have here the suction bottle. So this one should be attached on the wall as always with a pressure of -100 to -120. And then there should also be another suction tubing which will be inserted in this one. This thing is the thumb port, and then this is where we hook it up to the ET tube, and this is the suction catheter which is being covered, so which is why we call it a closed suction or inline suction catheter. So the reason why we have this inline suction catheter is we prevent the patient from having any risk of complications such as any infections or pneumonia. So once we're ready to use this one up and we already tested the suction bottle, so we have here the ventilator. So make sure we hyperoxygenate the patient by pressing this increase in FiO2, so we notice to be 100%. And then if we don't have that one, we can try to manually increase it to 100 like that by the knob, but just make sure that we have in mind the intended FiO2 of that patient. So after that, we have here the suction catheter. So the other hand is we hold it on the thumb port, and then the other one is we're gonna insert it to the patient's airway. When we push it to the patient's airway, it should not be pushed too deeply but carefully, and then we try to take note of the resistance, first resistance, and also if the patient does cough. If we sense both of it, we try to withdraw a few centimeters, and then while withdrawing and holding the thumb port, so we also press the thumb port while withdrawing, so we're able to suction and we take note of the secretions present. When doing the suctioning part, it should not be more than three times, and so it should not be more than 10 seconds. And then every attempt, we should also let the patient rest for a few seconds just to avoid complications such as trauma, bleeding, and even increase in their ICP. So once we're all done all those, we should always do our post-assessment, listening to the breath sounds if it's being cleared up. Take note also the patient's color, their SpO2 level, their heart rate, and everything. And then once we're all done, remove the PPE, wash your hands, and chart and communicate with the staff.